Question 3, let's go into it. So, Portland, along with other cities across the nation, is experiencing a rise of houselessness driven by the lack of affordable housing. Ongoing COVID pandemic has economically wrecked entire communities, devastating households, and significant and continued lack of access to mental health services, including healthcare-centered substance use disorder treatment. Despite credible research, we talked a little bit about that earlier, showing that police sweeps of houseless encampments do not solve our houseless problem, and it fails to lead to an effective housing solution. City resources continue to invest in this harmful process. So my question, and this is also a long one, we're gonna go over to you first, Mitch. How will you prevent the displacement of houseless communities and elevate real solutions that result in vulnerable Portlanders finding and maintaining housing? And two-part in there. How could the public safety service budget that is allocated currently for sweeps be better used? Let's get into it, 2 minutes.
It's a great question. So you hit the nail on the head. Sweeps don't solve anything. They cost money though, right? It's violent and it causes trauma. And so when you hear the rhetoric that people don't want services, they're servant resistance. One, I think that's like overblown. I don't have a lot of faith in that. But two, for those that maybe are, well, maybe you shouldn't have swept them before. Maybe you shouldn't have caused them trauma. And so if we want to get a situation, we want to move to a situation where, suppose we have the resources and we want people to flow into that. You know, like, here's some housing. Will you come along? You have to stop deploying the cops to sweep a camp. Like, you have to stop. That's the first piece, and you save money by doing it. And two, we have to have individual housing with a door where people can go and have some private space that's not just a mass shelter or a mass concentration camp. To put some color on it. People have to have trust that if they're going to move out of this little community that they've built, however fragile, that they're going to move into something that's a little bit better. And so it's only then can folks get stabilized into a longer term pathway. And then you can have things like supportive services housing, you connect with mental health services, then you move folks who were just homeless because they were poor in the first place, right, into social housing or some other sort of subsidized system. And you shouldn't have a backlog where folks have to wait years for it. Right? If someone's going through a crisis, maybe they're on the streets because they're addicted, or maybe because they're addicted to something because they've been on the streets. Causality is interesting that way. When they're in that moment that they want help, you have to have a place to put them. You have to have a treatment bed to put them. And so there's a whole nexus here that we have to invest in. And we'll pay for it if we stop deploying the police to sweep these camps, because that's very expensive.
Thank you. Just a note, I appreciate you really connecting it to violence. It's violent. Same question, 2 minutes. How would you prevent the displacement of houseless communities and elevate real solutions? Let's go.
Yeah, so really looking at sweeps is kicking the can down the road. Like, you are not helping anybody. They're just going to go set up somewhere else. So why waste this money and time and effort and cause, like Mitch said, a lot of trauma in the process? I have with some of the sweeps, and they've been very clever in the ways that the sweeps have happened recently, in that they targeted multiple camps at the same time and did them all at once. And so from a mutual aid standpoint, being weekly, handing out supplies, all of a sudden there were a whole bunch of people who needed things because all of their things were confiscated. There was no way for them to get them back. And I'm listening to people, since the camping ban started being enforced here in Portland, say that the police came and said, okay, do you want a fine or housing or jail? And there were a couple people who said fines, and a couple people who said jail, and a couple people who said housing, and they said, okay, if you want housing, we'll be back in 3 hours. Never came. So when Mitch was talking about establishing trust, we have to establish trust as a community. If someone's saying they're gonna get me housing and they don't, and I never hear from them again, how am I ever gonna trust that person again? And also, there's a lot of communication that happens on the street. So if there's a shelter that doesn't feel safe, that's going to get communicated. And so if the police are saying, hey, we're going to move you to this place, and they're like, I know that's not safe, then you have an impasse. And that's the situation that causes violence, is you are now infringing on that person's agency in a really, really big way. And so, I also think we really need to come at this from not a one-size-fits-all solution. We need culturally specific housing, we need LGBTQ housing, we need BIPOC housing, and really saying, sometimes the mass shelters work for people. Sometimes they like that community element. Sometimes they want a tiny house and a room with a door, and that's great. But I do think that the city is doing these strategies where, for instance, they're going to give people a hotel room, but sometimes they'll give that to a young person and they'll say, okay, you can't have any of your friends over here, you can't have any of your drugs, you can't do any of the things that you like to do. And so they're isolated, and there's a high rate of unhoused youth suicides because of that hotel program. And I've been hearing that from nonprofit directors who are filling in these government gaps. And it's just heartbreaking. And so when we're really thinking about these strategies, we have to think about the downstream effects. And I think that incentivizing businesses to say, okay, if you provide hotel rooms to the houseless community, that's kind of just a weird trickle-down version of housing. Like, it would be easier to give people money and just do that directly than incentivize these businesses, because what's happening is that businesses that are already providing low-income housing on a permanent basis are shifting to temporary hotels to get those government incentives. And so they're kicking out services and people who are already in those low-income situations. And so as policy people, we need to be really clear about what the downstream effects are and measuring our impacts to the community.
Thank you so much. I hope the viewers and watchers are listening to these policy ideas and connecting values to our actions. You mentioned a few things, and things that I've heard. I've heard the rise of suicide, particularly in these hotel rooms. We're filming right now in Old Town Portland, and we've seen constantly folks that we see every day that we say hello to are just being shifted into jail. And we're going to put some links, but there's also been a rise of people dying in our jails. Particularly, I'm thinking about Multnomah County. For those who are who are listening, yeah, people aren't making it. Let's keep talking. We have some more time. I'm going to pass it to you. Do you have any thoughts, particularly, I think, around this question you mentioned? Folks are saying fines, jail time, or quote unquote housing, shelters, things that actually we're not doing well. Let's pass it to you. Yeah.
Those aren't real choices, right? I mean, if someone's living on the margins of society and they've just got a couple bucks to their name and like a tarp, are they gonna pay a fine? They're not gonna pay a fine. So then it becomes like housing or jail. There's no housing, right? So it's really just jail. And so that it's sort of a backdoor way of saying, we don't want to see these people. We would like to remove them from society. The thing that we know how to do, the one administrative capability that we have is just putting someone in a squad car, taking them to jail. And to me, that's a gross violation of our civil rights. It's profoundly unjust. It's also costly if you care about the budget, right? But we can do much better. I think, you mentioned, this idea of the one-size-fits-all model. I think we need to be, I totally agree. We need to be really nuanced. Like, there are people with pets. There are people who want to be sheltered, but who are living with addiction or a mental health crisis or both. And you can't have a private provider put their own moral frame on the conditions of that housing if you want people to be successful in that. And so I'm a big, I don't like that. So I think we need a public sector approach that says, we take you as you are. And we are not gonna legislate how you have your path to recovery, whether that's drug addiction or mental health. We're just gonna give you the resources you need to navigate your way out of that. A good society that had a care economy would say, let me give you some drugs that are clean and safe. And then, by the way, we have a nurse on staff, and we have a mental health professional on staff. And when you're ready, we can help you recover, but you're not going to overdose today. That to me is the way that you treat a society that you want to recover, and that you don't throw people away.
Thank you so much for that. There's some things I want to dive into, some follow-ups. So you talked a lot about harm reduction. For folks who may not know, we decriminalized drug use not that long ago, and then we recrimmed it, but only for the folks who are living on the streets. Let's be honest. If you have the privilege to live in a home, you can continue to do those drugs. You can continue to do anything you want, essentially. But you can in the hotel rooms. You can in the shelters. You talked a little bit about which I've seen, I would say, around the country and also around the world, these clean spaces for folks to get the care that they need without judgment. Places they can get clean needles, places where they actually can use and make sure that they can do what they need to do to get on their recovery path. What we don't, and what data has showed us, is jail is not the place to get the drug addiction services you need. It's not the place you can get mental health services. So I'm curious, just thinking a little bit about this policy to recrim working poor and poor people. Let's talk a little bit about addiction. Yeah, I'll pass it to you.
Yeah, honestly, the recriminalization of minor drug possession has been devastating to watch, and just I feel like it represents a real failure in our government to listen to voters, because we voted that in, and then policy changed that to some degree, made it more nuanced. We added these deflection centers, but there's so much disagreement in the government around all of this, and I've heard so many other candidates really say that, oh yeah, Measure 110 was a complete failure, and I don't agree. I really think that we didn't, like, when something doesn't quite work the way you wanted it, you tweak the solution and you keep moving, right? So I really think we should have allowed ourselves to experiment and fund that better, and we just didn't. We haven't given that the chance to thrive. And I'm absolutely with Mitch about safe consumption sites. I think that's really important to have the resources and the staff on site so that people can do that safely and have safe options. And then, yeah, let them choose when they're ready to seek recovery services. And if you force someone into recovery, whether that's judicially or just by saying you don't get housing unless you are drug-free, you're creating a situation where relapse is really likely to happen. And so you're actually going to create more harm that way than allowing them to use the drugs in the first place. And additionally, a lot of where the drug addiction crisis comes in is like searching for the drug. And that's where violent situations can happen. If someone's experiencing withdrawal and they're struggling to find what they need, they're more likely to be in a crisis state. And so if there's access points, that can be safer for the whole community. And I think it's also really important to talk about where those services are in the city. And I would really like to see particular neighborhood association coalition groups come together and, okay, let's say there's, just as an example, like 5 coalitions of neighborhood associations in the city. Okay, we need 5 safe consumption sites. You, as a neighborhood association coalition, get to choose where it goes, but it needs to be in your neighborhood so that we're not putting all of the burden, honestly, on Old Town to provide all of these services, because it's already an underserved area of the community. And so, yeah, really being thoughtful about where those services go, how we're treating people, and making sure that when we're coming up with policies, we include people who have experience with drug addiction in the conversation to make sure that their voices are being heard as well.
Thank you so much. Same question back to you to expand upon a little bit. Yeah.
Yeah, I would just say that when you face tough issues like drug addiction, there are no shortcuts, right? It is a shortcut of convenience to say, whoop, let's roll this back. Didn't like the results in a couple of years, so let's go back to the thing that also doesn't work, that we know that doesn't work for a long period of time. The war on drugs doesn't work. You cannot criminalize drugs out of existence. What you can do, though, is you can replace a harmful drug with one that has much lower fatality level, and you can build systems of intake and recovery. You can do that, and that's what we need to do. And until we are ready to square up with that, we're going to have drug addiction in the city. You cannot arrest your way out of it. This is a very personal thing for me as well. My brother was addicted to heroin in this town in Seattle, and kind of back and forth for a number of years. He was an Iraq War vet. I have a lot of veteran friends in my life that suffer from this or have suffered from this. And he was lucky that he was addicted to heroin and not fentanyl or something else. And it was only through his union backing him up, writing the judge, being willing to give him a job on the way out, me with my PhD, like writing the judge, the Veterans Administration, my dad pulling strings, a whole community. After 3 years of working and fighting, that he finally got clean and got back into society, and now he's a productive member of society. He's very happy, he's very successful. I want that for every family. I guarantee you, we all know someone, whether it's directly or degree separated, a cousin or whatever, that is suffering this way. And I don't want to live in a city where we throw people away, right? We sort of give them a death sentence by saying, we're going to lock you up, and when you get released, your tolerance level is such that when you find a drug again on the street of unknown quality, you're going to overdose and die, or you're going to overdose and die in jail. Like, I don't want that. We shouldn't do that to people who live in our city.
Thank you. Before we move into our final thoughts of this question, I want to remind folks to do some research. Particularly, I want to note that across all income levels, this has been researched. We all use drugs. It's not just something for houseless folks or for poor folks or working poor. This is something that affects all of us. And I would say same with addiction. This affects all of us. But if you're privileged enough to have resources, to have wealth and money, to be able to have shelter, your likelihood of surviving is very, very different. And having community is a big part of that. Let's just do some final thoughts. Let's go to you first, and then we're head back to Mitch.
Yeah, I just want to have some awareness that these are really difficult conversations. And so for viewers, if you need to just take a mental health break and like resource yourself and take a few breaths, that's totally welcome, because these are hard, tough conversations. But this is what we're seeing on the streets every day. And I really just want to really express deep empathy for the people who are trying to live on the streets. And it is not easy. You have to have your crises in public. You have to figure out your bathroom situation in public. You have to find places to eat in public. You're standing in lines all day long. And so to whatever extent we can bring empathy into this conversation and see these people as our neighbors and get them opportunities and let them choose what opportunities they would like, that's really, I think, how we're going to move forward as a city. And otherwise, like Mitch said, we're just going to be rolling the clock back and losing ground.
Thank you. Any last closing thoughts?
Yeah, I do want to acknowledge the salient point you made, which was that if you have money or you have privilege, you can use drugs or alcohol and for a really long time and function in society. You can go to your job. You can keep your relationships together even. It might be difficult, but you can do that. When I think about cocaine, I think about stock traders and Wall Street, right? I mean, it's expensive, and it's associated with high risk activity and people who have the ability to pay for that stuff. And so when those drugs enter communities that historically are under-resourced, it's way more harmful. And the quality control is not there. And there's no margin for error, right? So who among us has not, walked the edge and come out of it, or maybe you didn't. And that depends upon your circumstances. So I think it's something that we need to keep reminding folks of. And if you're going to be a leader in this city, you need to stand up for that.
Thank you. For folks watching and listening, this is the Reimagine Public Safety Debate for Black Portland, hosted by Imagine Black and produced by Labs.